Hi, my name is Nick. Thank you for joining me for another episode of the weekly longevity report. I'm a family doctor with over a decade of clinical experience, and I published this report to provide you with a review of a recently published article on the topic of longevity, to place that article in the context of what's already known, and to give you tips for what to do based on the results of the study. Today, we're going to answer the very important question of whether or not to take a daily aspirin to prevent heart attacks and strokes. We're going to look at three related articles. Before we do that, I want to give you some background. Cardiovascular disease, which includes heart attacks and strokes, are the number one cause of death in the U.S., accounting for more than 1 in 4 deaths. It's long been known that taking a baby aspirin will reduce your risk of heart attacks and stroke if you have already had a heart attack or stroke. And the benefits of aspirin to prevent a second heart attack or stroke outweigh the risks of major bleeding, which is a side effect of taking aspirin. But what's been far less clear is whether or not the benefits outweigh the risks for taking aspirin if you've never had a heart attack or stroke and you're using it to prevent a first event. See, aspirin works by blocking platelets from forming clots. That's really good when it comes to preventing heart attacks and strokes. But a clot is important to stop bleeding. So taking aspirin also increases risk of a major bleed. And major bleeds can happen in the brain, and major bleeds can happen in the gastrointestinal tract. So for people who have never had a heart attack or stroke, there's debate over whether the benefits of reducing that risk of heart attacks and strokes are outweighed by the increased risk of bleeding. In 2016, the evidence was strong enough to recommend aspirin. The benefits outweighed the risks for people aged 50 to 59 with a 10% or higher risk of cardiovascular disease. These were the recommendations by the United States Preventive Service Task Force. The USPSTF is basically what advises doctors on what to tell patients to prevent problems. They gave aspirin for age 50 to 59 and 10% or higher risk a B rating, which means that it's an important and strong intervention for reducing heart attacks and stroke. So as a result, doctors recommended aspirin for age 50 to 59, 10% risk or higher. And now 1 in 3 adults age 50 or older take a daily aspirin. But since 2016, there have been several important studies that have come out to look at the benefits and risks of aspirin. And that has led the United States Preventive Service Task Force to commission 2 studies to reevaluate their position on aspirin. The first study is a systematic review and meta-analysis of 11 randomized controlled trials over 130,000 adults. The researchers found that taking a daily aspirin reduced risk of a major heart attack or stroke by 10%, but also increased major risk of bleeding by 44%. It had no effect on overall mortality. It had no effect on colon cancer mortality, which was another question. And it had no effect on cardiovascular disease mortality. The findings from this study are a little bit hard to interpret because they talk about a whole population and they present what's really already known, that there's a benefit and a risk from taking aspirin. The second study is a modeling study using the data from the previous study. Basically, the researchers stratified the population that had been studied into age, gender, and cardiovascular risk and determined whether there was a net benefit to taking aspirin that outweighed the risk. Based on the systematic review and meta-analysis and the modeling study, the United States Preventive Service Task Force updated their recommendations on the use of aspirin, and they published their recommendations also in the Journal of the American Medical Association, also in April 2022. The USPSTF looked at the results from the modeling study. They even highlighted the table from the modeling study. Specifically, they highlighted the groups that would benefit from aspirin, both in net life years gained and net quality of life improved. And they distilled the findings into the following recommendation. Adults aged 40 to 59 with a 10% risk or greater might benefit from aspirin use. They downgraded their recommendation to C level. I have 3 concerns about this updated guideline. One is that it's been moved from B level to C level. In primary care, there is very little time to address what's important. The United States Preventive Service Task Force grades their recommendations. If it's A or B, it's definitely going to be beneficial. We're definitely going to bring it up in the visit. But C recommendations, though it says we're supposed to discuss them, they rarely have time to be discussed in the visit. So my first concern is that aspirin isn't going to be discussed anymore in the primary care visit. My second concern is that the groups that would benefit aren't just 10% or greater. The results of the study show that at a 7.5% 10-year risk, men would also benefit. Women would not, but at a 7.5% year risk, 7.5% 10-year risk, men would benefit from aspirin in the age group of 40 to 59. But the updated recommendations only talk about people at a 10% risk or higher. Furthermore, aspirin for age 60 to 69 would be beneficial for someone at a 20% or greater cardiovascular risk. But the new guidelines suggest that people at age 60 or over should not be recommended aspirin at all. And my third concern is that the table and the analysis that the USPSTF did excluded a 5% risk of cardiovascular disease. In fact, men at a 5% 10-year cardiovascular risk in the age group 40 to 49 would benefit from aspirin. But the guidelines are only suggesting we consider it in people at a 10% risk or higher, which is not consistent with the evidence. So my bottom line is that a daily aspirin can definitely be beneficial for specific groups. And the current guidelines don't reflect this evidence accurately. My personal recommendation is don't just take a daily aspirin because you're 50 or over, but also don't wait for your doctor to bring it up. It's likely not going to be addressed anymore in the primary care visit based on these new recommendations. My recommendation is you determine the risk and benefit of aspirin use for yourself. And I've developed a 4-step process for how to do that. So first of all, you want to consider, are you a candidate for aspirin? Are you age 40 to 69, without a history of cardiovascular disease, and without a history of major bleeding or a condition that would predispose you to major bleeding? So if you meet those criteria, you're a candidate. That's step 1. Oh, and by the way, if you already have had a heart attack or stroke, you almost definitely are recommended some form of an antiplatelet medication like aspirin. Talk to your doctor. And my recommendations here are people who have not had a history of heart attack or stroke. So step 2 is gather your recent blood pressure reading and your cholesterol results. This will enable you to determine your 10-year risk. You go to the atherosclerotic cardiovascular disease, ASCVD risk calculator, and I'll provide the link in the show notes. You enter your information, including your blood pressure and your cholesterol. Once you have your 10-year risk, you can determine whether or not aspirin is appropriate for you. I've created an online calculator that you can use to do just this based on the results of the modeling study. All you have to do is enter your age, your gender, and your 10-year risk, and it will tell you whether there's a gain or a loss in years of life and in quality of life if you were to take aspirin. I'll give you an example of how this works. You're a 45-year-old white male. You get your recent blood pressure and your cholesterol results. Turns out, using the online ASCVD 10-year risk calculator, you have a 6% 10-year risk. Use this HealthScore calculator that I'm going to show you how to access in a minute. Enter your gender, your age, and your 10-year risk. So in this person, he's a male. He's in the 40 to 49 age group. He has a 5 to 7.4% risk. It spits out a result. His net quality of life years for 1,000 people is 23.1. His net life years is 10.6. If both numbers are positive, and they'll show up in green, then there's a benefit in terms of years of life and in terms of quality of life for that individual to take aspirin. If you were to get a negative number, and it would be seen in red for either the quality of life years or net life years, this would indicate there's actually a harm from aspirin, and he wouldn't take it. You could also directly reference the table from the study if you don't want to use the online calculator. So thank you for watching. I recommend you get a copy of the HealthScore aspirin calculator. You can get it at healthscoreonline.org/aspirin. I'll put that in the show notes. You can subscribe to the Longevity Report, which is a weekly email if you like what you've heard today. You can listen to the HealthScore Longevity Report as a podcast wherever you get your podcasts. And please join our HealthScore Longevity Facebook group. Stay tuned. Next week, we're going to talk about a study on whether or not physical activity reduces risk of depression. Thanks for tuning in, and see you next week.